What's the cost of a dental bridge? What's the difference between a dental implant and a bridge? And are dental bridges safe? I'm going to be answering the top 10 questions you might have before your next dental bridge appointment. So what exactly is a dental bridge? A dental bridge is a way to replace one or more missing teeth, and it works by anchoring to healthy teeth, and it allows you to smile again, or it allows you to chew again. Now, a bridge is cemented or bonded into place, which means that it is non-removable, and it means that you need to take really good care of it with awesome oral hygiene, which we'll talk about at the end of the video. And the material we use really depends on whether aesthetics are of concern, whether we need more support, or whether we need more strength, and things like that. If you're looking to replace teeth in the front, in the smile zone, then we typically want something more aesthetic, like zirconia, Emax, porcelain, things like that. But if you're looking to replace teeth in the back, then we might need something more resistant to fracture, like gold or something with a little bit more strength. Are dental bridges safe? Yes, they are safe, but there are things you need to consider. When we design a bridge, we have to prepare the anchoring teeth or abutments in order to get a minimal thickness to allow us to fabricate a bridge that is strong and that doesn't break on you in the future. This means drilling sometimes perfectly healthy teeth in order to make the bridge work. And that's something you really have to think about. Is it worth it to prepare perfectly healthy teeth if you can avoid it by doing a procedure like a dental implant? And I would argue that no, most of the time it's not worth it to prepare perfectly healthy teeth. But there are times where bridges are indicated because implants can't be done because maybe there's not enough good bone density or bone thickness or things like that. So who can get a bridge? Well, in order to get a successful bridge, we need at least 2 healthy teeth in the area between the missing teeth. So the first thing that we need to evaluate is the strength of these anchoring teeth. If these teeth have a crown on them, or they have a root canal on them, or they have a large filling on them, they may not be strong enough to support the occlusal forces or bite forces that come into play when you have your bridge in place. And what can happen is that if they're too weak and you cement a bridge onto that weak tooth, that tooth can break and eventually you might lose the bridge altogether. The second thing we need to consider is the length of the bridge. If you have a long spanning bridge that's replacing multiple missing teeth, then those teeth may not be strong enough to support all those units of missing teeth that you're replacing. And in those cases, some dentists will prefer to do multiple abutments to support all that force that gets distributed on that long spanning bridge. It's something that I definitely don't recommend because I've seen a lot of these bridges, and typically because it's so hard to clean, they don't last a long time. The anchoring teeth start breaking down, and eventually we have to transition to implants or a removable partial denture. Do you need a bone graft with your dental bridge? So this point is meant for people that have a broken tooth that needs to be extracted, and they're looking to see whether when they get that extraction done, should they place a bone graft or not. So when you extract a tooth, you need to know that your bone starts to shrink towards the extraction site, and sometimes that will leave you with an indentation in the gums. This is important, especially if you have an extraction that's occurring in the smile zone where you see your smile, especially for people that have a gummy smile where you can see the gums below the teeth. If you don't place a bone graft, then you're gonna have that indentation in your gums, and you have to design the bridge in a way where the pontic may have to be higher up, and it's gonna look a little unnatural. Remember that the goal in dentistry is to make everything look really aesthetic and natural. So if you have a broken tooth in the smile zone, or even in one of the back teeth, typically I recommend to take the tooth out, place the bone graft there so that you don't have that indentation in your gums, and it's gonna leave you with a more aesthetic, more beautiful result. So what happens if one of the teeth anchoring the bridge fails? Well, unfortunately, if one of your anchoring teeth fails by either a fracture or maybe there's a big cavity and the tooth has to be extracted, then the entire bridge has to be replaced. Typically, this involves using our dental burrs, creating a section in the bridge, using a curved T-bar or an instrument to leverage the bridge out. It may come off in pieces, but it's something that can be really annoying or frustrating for someone who spent a lot of money money getting a dental bridge done. So that is something that can happen. So if you have a dental bridge, it's really important that if you notice yourself grinding your teeth, consider getting a night guard. It's important to clean it well, which we're going to talk about very soon, and just keep very good care of your dental bridge. How do you clean and maintain a dental bridge? Well, in terms of brushing, it's going to be the same way that you clean your natural teeth. You're going to brush at a 45-degree angle between the gum line and your tooth, or the gum line and the bridge, and you're going to make sure that you're removing the plaque and debris that gets stuck on our teeth throughout the day. But what's different is that the space where you're missing the tooth, where the pontic hovers over that space, you have to clean under that site. And typically what's going to be recommended is that you get a floss threader where you attach the floss to the floss threader, you go under that site, and you transfer the floss back and forth to remove any plaque or debris that gets stuck under the bridge. Another really powerful tool to keep things clean is going to be the water pick. A water pick uses pressurized water, and it blasts water into that site, and it can remove any food or debris that gets stuck under the bridge. Okay, so how long does the dental bridge procedure take? Typically, it's going to take 2 appointments. 1 appointment for the preparation and 1 appointment for the cementation or bonding procedure. So for the first appointment for the preparation, typically you're going to get numbed up on the site of the 2 anchoring teeth. They're going to prepare a minimal thickness around the tooth, on the top of the tooth, on the sides of the tooth. They're going to give you a temporary bridge that you'll leave with that same day. They're going to make sure that the bite fits well. Of course, they're going to take that impression before that, and that goes out to the dental laboratory. Once it goes to the dental laboratory, the lab technician is going to have a model of your preparations. They're going to design a bridge that closes the gap well, that looks really natural. Now, after 2 weeks, we're going to get the bridge back. We're going to try it in your mouth, and we're going to make sure that we have nice flossing contacts on the side. We're going to make sure that we like the contour and the shape of the teeth. We're going to make sure that the color is on point and that you approve the color. And if everything checks off, then we are going to cement or bond it into place. Now, with the advent of CAD/CAM technology, there are certain offices that can do the dental bridge appointment in 1 day, but there are limitations to CAD/CAM technology, and if you want me to talk about those limitations, I can definitely talk about that in another video. So will the dental bridge look natural? Will it look real? And the answer is yes. Material has evolved so much nowadays where they're taking into account optical properties of your natural teeth, translucency. They're taking into account how the light reflects off the bridge and how to mimic it as closely to Mother Nature as possible. So we do have amazing material like lithium disilicate, which allows us to get really amazing results. But I do want to say one thing. When we're working in the smile zone or the cosmetic zone of the mouth, you have to understand that a dental bridge or a dental crown or a dental filling doesn't change color over time, but your natural teeth do. So if you're drinking coffee, tea, red wine, blueberries, blackberries, or eating blueberries, blackberries, your teeth are going to stain, but your dental bridge will not. So over time, it may be the case that if you started out and the color was perfect and on point, the bridge may look brighter than usual after 5 years or so because your natural teeth have gotten darker. Okay, so that's something that you need to consider. So if you're about to start the procedure, I definitely encourage you to consider getting whitening done first if you want to whiten your teeth to a shade that looks a little bit brighter, and then doing the dental bridge procedure, because it's much easier to match the color of a bridge to your natural teeth than to whiten your teeth to match a bridge, if that makes sense. So should you get a dental bridge or a dental implant? Well, like I said earlier before, there are some indications and contraindications for receiving a dental implant. So you have to make sure that you have good bone quality, bone density, get a consultation with an oral surgeon or an implant dentist, and make sure that you even have that opportunity or option available. I personally prefer a dental implant over a dental bridge for a variety of reasons. Number one, I don't want to prepare the adjacent teeth if they're healthy or if I don't have to prepare them. Remember that in dentistry, when we're preparing a crown or a bridge, that procedure is irreversible and you cannot regain that tooth structure, at least right now. So with a dental implant, you don't have to prepare the adjacent teeth. You take that dental implant and you go straight into the bone. So that's really nice. It also allows you to floss in between each and every tooth, which makes it more cleansable. And an implant ultimately is going to be the tooth replacement option that most mimics your natural teeth. Now, can implants fail? Yes, they can fail. So nothing is a perfect solution, and each of them have their benefits and their negatives. And finally, how much does a dental bridge cost? The cost of a dental bridge depends on how long spanning the bridge is. If you have a 3-unit bridge, then typically each unit is going to cost anywhere between $800 to $1,400. And of course, this varies depending on the location that you're at. It varies depending on your insurance, varies depending on a lot of things. So it's always hard to give an accurate quote. So the best thing to do is obviously look for a dentist that you trust, get a consultation with them, and basically ask them price, and you can get a more accurate estimate that way. Thank you so much for watching my review on dental bridges. It's a topic that was requested in my comments, and I haven't made a video on dental bridges in a long time. I hope this helps anyone out there that is looking to get the dental bridge procedure done, and I wish you the best of luck. Thank you for watching, and I'll see you for the next one. Thanks.